Common hoof problems, signs, symptoms, and treatment. Winter is here, and with it comes a few good things and sometimes a few things which are not so good. With the wet months upon us, the likelihood of horse hoof problems is greater. Here we are going to address some of the most common problems and what to look out for. Abscess symptoms, abscesses in the hoof, are typically characterized by sudden onset, severe lameness. In some cases, the horse may refuse to put any weight at all on the affected hoof. The horse will be sensitive in the area of the abscess and may have an increased digital pulse and swelling in the lower leg. If left untreated, the abscess may erupt on its own through the sole of the hoof or at the coronary band. What causes an abscess? A hoof abscess is a pocket of infection in the lamina. It can start with a puncture wound caused by the horse stepping on a sharp object or many other causes. The hole allows bacteria to enter the hoof, where it thrives in the warm, dark environment. While the bacteria eat away at the hoof tissue, the horse's immune system attacks. The resulting pocket of bacteria, white blood cells, and dead hoof tissue puts pressure on the sensitive structures of the horse's hoof, causing the pain response. Abscess treatment. If the abscess is easily located and drained, the key is to keep the area clean to avoid reinfection. The hoof should be soaked in a solution of Epsom salts in warm water to help draw out any remaining infection or to draw out an abscess that is not easily located. The hoof should be kept bandaged until it is healed. An anti-inflammatory may be needed to manage the horse's pain, and Equine Challenge Lamini 911 is highly recommended. The recovery period can be a week to 10 days, but this can vary widely depending on the severity of the abscess and the owner's ability to prevent reinfection. Bruises of the hoof and symptoms. A horse with a bruised hoof can show varying degrees of lameness. Some will be off only on uneven or rocky surfaces, while others may be consistently lame. A sole bruise may show up as a visible mark, but a horse will usually show lameness or sensitivity before the bruise actually appears. Causes for bruising. Bruises on the hoof and frog are very common. The most common cause is when the horse steps on a rock or hard uneven ground. Crusty, icy snow can also lead to bruises. Regular work on arena footing that is too hard can also cause bruising, as can taking a horse that is primarily ridden on soft footing and working him on hard ground. Improper farrier work can also lead to bruising. Some horses have thinner soles or flatter feet than others. This can predispose a horse to bruises. Left untreated, a simple bruise can become an abscess as more blood pools in the affected area. Treating bruising. If your horse is showing signs of bruising, soak the affected hoof in ice water. This will prevent the rapid blood flow to the area that causes bruising. In more severe cases, you may need to treat with an anti-inflammatory, and again, Equine Challenge Lamini 911 is recommended. For thin-soled horses, we recommend Equine Challenge Hoof Propel. You can reduce the risk of bruises by being diligent about picking your horse's feet daily and before and after every ride to remove any rocks that may be stuck in his hoof. Keeping the hooves clean and dry will also help, as wet soles may be more prone to bruising. Another option is hoof boots that cover the entire hoof when competing on long rides or over especially rough terrain. These boots can prevent bruises and other hoof injury while giving the horse some extra traction. Laminitis symptoms. The coffin bone of the interior of a horse's hoof is attached to the inner hoof wall with Velcro-like structures called laminae. When the sensitive inner laminae become inflamed, the horse is suffering from laminitis. If the inflammation is left untreated, the sensitive laminae are weakened, leading to potential separation of the coffin bone and the hoof wall, which can lead to rotation of the coffin bone known as founder. Laminitis causes varying degrees of pain. It can affect 1, 2 or even all 4 hooves. A laminitic horse may shift his weight back and forth or stand with both front feet stretched out, often referred to as the sawhorse stance, in an attempt to take weight off of his hooves. The affected hooves will be notably warm or hot, and the digital pulse will usually be elevated. If made to walk, the horse may move in a hesitant manner. What causes laminitis? There are numerous causes for laminitis. A common scenario is one where the horse is let out into a lush, spring pasture and gorges himself on rich grass. The high-carbohydrate, easily digestible spring grass is broken down rapidly by the bacteria in the horse's gut. This fast digestion causes a byproduct which is absorbed into the horse's bloodstream, where it becomes a sort of toxin, causing inflammation in the lamina. This same scenario can play out in situations where the horse has broken into the feed bin and gorged himself on grain. Other causes include heavy concussion, such as a horse that gallops or is worked at a high stepping gait on a hard surface, or a hard workout without appropriate cool down. Exposure to environmental toxins such as black walnut can lead to laminitis. Obese or crusty horses are more prone to laminitis than fit and thin horses, but any horse can be affected. Laminitis can also become a secondary issue if a horse is compensating for an injury on one leg by putting most of his weight on another. Treating laminitis. If laminitis is caught early, standing the affected hooves in ice water can slow the progression of the disease. Equine Challenge Lamini 911 is highly recommended. As hard as it is to watch, a laminitic horse must have daily movement. Horses that have had laminitis can be more prone to it in the future, so proper management is key. The horse should be kept off lush green grass and rich hay during the recovery period. Soaking some grass hay before feeding it to laminitic horses can also be helpful. Overweight horses are more prone to founder, so keeping your horse's weight down, even after he has recovered, may be necessary. For more info on getting weight off your horse, visit the Equine CHALLENGEIR page at the Equine Challenge Supplements website. Thrush symptoms. Thrush is a bacterial infection that primarily affects the grooves of the frog. The infection causes a gooey black discharge with a distinctive foul odor. In most cases, thrush will not cause significant pain, but if left untreated it can cause sensitivity in the frog and heal and ultimately lead to lameness. What causes thrush? Thrush thrives in a wet, dirty environment. Horses kept in a muddy paddock or left to stand in a dirty stall are especially at risk for developing thrush. When mud and manure are packed into the hoof, the dark, warm, wet sulci become the ideal home for bacteria to thrive. The bacteria eat away at the hoof tissue, causing the telltale black discharge. Treating thrush. In most cases, a horse owner can treat thrush quickly and easily by applying a commercial thrush medication to the sulci. Picking your horse's feet regularly, keeping your stalls and paddocks clean, and making sure that your horse has somewhere dry to stand in the pasture during wet months are the keys to prevention. Please visit the Equine Challenge video stewardship page for info on treating thrush and white line disease using a vinegar wash. White line disease, seedy toe, symptoms. White line disease is characterized by a separation of the inner hoof wall which may be visible as a hole or crack on the sole at the toe. Bacteria and fungi invade the space between hoof wall layers. As the infection eats away at the hoof tissue, the hoof may